All right, so
call
I
that,
understand that you guys are here because you've got some issues with one of our patients, more particularly with the family member. I'm sorry, let me just get to my chart notes here. That basically this daughter has refused to understand her mother's condition. It wants us to continue to treat this patient when really there's no clinical basis for continuing treatment. And so we need to basically get this daughter to understand that it's time to stop.
When you say that she's refused, have you gone through the process and explained it to her?
Well, what we want is we want permission to make her DNR and stop aggressive treatment. And at this point we have not had the opportunity to do that. I am really quick wanting to just review my notes so that I remember everything that I'm doing. But this daughter is really asking for everything, and that makes no sense to me. I don't even know what she means by everything, but we're doing a lot of things at this point that I think are meaningless, painful, unhelpful, and I'm not particularly willing to continue doing it.
Has anybody talked to her, the nursing staff, or any of the...
I mean, I've talked to her and explained that there's no hope of benefit any longer. I don't know what other conversations have been had with her.
In that conversation, what did the daughter share with you?
I mean, that she wants everything done. That,
Did she say why?
Well, when we're going to, we were discussing what treatments we've currently initiated and what things we're involved in and which ones I'd like to stop. And her response is just that she wants everything done.
And which things did you want to stop?
I think we need to stop the pressors, stop the, not start antibiotics. I mean, I think that we need to turn everything off. I don't mind keeping the tube in and keeping her ventilated, but I think we need to stop everything else. I think everything else falls under aggressive fetal therapy.
Is this daughter the only family member?
She's the only one that I have spoken to. I believe that there is one other. Just looking at the chart. I believe that this is the only family member. Mm-hmm. You know, we talked to the patient when she came in. She said that she wanted us to be aggressive in treating her, and I feel like we've done that.
Is her illness at all survivable, in your opinion?
I mean, at this point, there are so many things going on with her. I think that she's really gone into multi-organ system failure, and that there's no chance of fixing all of them, and I don't think there's really any chance of fixing any one of them. But, you know, she's anemic, she's got no blood pressure, she's being artificially ventilated, she's just oozing fluid because we're trying to put so much fluid into her to keep her blood pressure up that her body just can't even keep it in her anymore. She's got pleural effusion, she's got the severe anemia from having blood recently.
Do you think there would be any chance of her going home?
None.
How about her going home if we withdrew the medicines?
None. She's
How
not,
quickly do you
I mean,
think
partially
she would have?
because right now she's ventilator dependent, so she would need to go somewhere with a ventilator, which pretty much rules out going home. I think that if...
Was she at home or at a nursing home before?
She was at a nursing, no, I'm sorry, she came from home.
But you want to keep the tube in for breathing?
Yeah, I mean, I don't think it's appropriate to let somebody suffocate to death. I don't want to suffocate her, but she's septic, she's got the bleeding, she's got the cancer, she's got something going on in her brain that's almost undoubtedly METS, but could be a stroke, could be any one of a number of things that indicate at this point that she's brain damaged, even if we can fix everything else, which I don't think we can.
So I'm not clear yet. What is the medical treatment that you want to offer?
I don't want to offer any medical treatment. I want to...
Discharge home?
No, I believe that we need to stop treatment and allow her to die. I believe that she is dying, will die anyways. And everything that we are just doing now is invasive torture.
So you keep her on the vent?
Yes. I mean, I don't want, like I said, I don't want to suffocate her. That's not my point. But she would have no blood pressure if we weren't putting all these medicines in to keep her blood pressure up. And as it is, her blood pressure is only 30 to 40 systolic, which isn't perfusing her brain. You know, she's, like I said, septic. She's either got a PE or severe congestive heart failure. I don't think we should treat the sepsis. I don't want to work her up for a PE. I don't want to continue the pressors. I don't want to give her any blood transfusions. I don't want to do anything other than leave the vent on, and I believe that she'll die soon after that.
And is she on antibiotics now?
No.
No, okay. Okay. Anything else? Let's go find Miss Wall here.